My name is Jolene George. I am a Port Gamble-Sklallam tribal member and the director of our behavioral health services within the tribe. And I have with me our department's attorney. The two of us wrote the Title IV-E plan that we'll be talking about today, and we were happy that we came early enough to spend the week with you here, because we've learned a lot about some of the differences, but also I think are hopeful that we can provide you with some information that will be able to help you move forward. So a little bit of history of our tribe. We're very small. We're only about 1,300 acres. We're located on the Kitsap Peninsula in Washington State. We have a little over 1,300 enrolled members. About a third of them are children. And a little more than half live on our reservation. The rest most live within the county surrounding us. We operate our own Indian Child Welfare Program and have since the mid-1980s. We have an extensive family code that protects our children in need of care. And we have our own tribal court that handles all of our cases. So the reason that we started looking at 4E, probably 10 years ago, and started trying to prepare our services and our things around that, because we believe that all of our children have a right to their culture. It was always difficult for us to locate a placement for children who do not have relatives, a lot of times able to take on that extra financial burden of having another person to raise. And until 1998, a family could only receive additional funds for that if they had child support or if they were on welfare or licensed by the state. So in 20 years, we only had 3 state-licensed foster homes on our reservation. We could not find relatives, so a lot of our kids were going off-res. Almost all of our kids were going off-res. The children that were being placed in our state-licensed homes were mostly non-native or other natives. So we started using Tribal TANF to support our children. In 1998, we began a Tribal TANF program. And the Tribal ICW, which is under the same department for us, was able to help them secure Tribal TANF for taking in their children. In 2001, just a few years after we started TANF, we changed our policy that a court-placed child could be considered a family of one, even if he or she was placed with their siblings. So those of you that know about TANF know that a sibling group is you get a base rate. Ours is currently it's I think $352 per child. It's like an additional $40 or $50 for the next child. So with our Tribal TANF program, we count them as their own grant. So we pay the full amount for each child, and we do not require that they say they charge their children rent to receive their TANF. So it makes a big difference. It's still not enough. But instead of paying, for instance, like I said, a family of 3 would have only been $530, the tribe pays the $1,000 for these 3 children, so they get the rate for each child. Like I said, both programs for us are under the umbrella of social services. We're actually in the same building. So our Indian Child Welfare and TANF programs could coordinate fairly easily, oftentimes could fill out the paperwork ahead of time and walk it right down the hall to make sure there wasn't a delay in payment. We use TANF to help pay for clothing vouchers, emergency child care, and sometimes food. So because we started using TANF to support the Indian Child Welfare Program, we did see impacts on our Tribal TANF. It can be used to support foster children, but it's not an unlimited resource, and we quickly saw that we were headed for some financial problems if we didn't figure something out. Families had to move out of our service area or become licensed for us to save TANF dollars. Our caseloads were not going down. You can see we were rising. We recognize that our children are not just citizens of the tribe, but that they are also citizens of the state, and that the state owes it to them to be providing them the same level of service. The federal law, ICWA, and state law allows for tribes to license their own foster homes. But unless it was a state licensed home, the state refused to pay the maintenance payments for us. We then spoke with the Bureau, who refused maintenance payments unless the state couldn't pay it. The state would allow the tribe to become a private licensing agent, a child placing agency of the state, which means we use their standards and certify that the homes meet those standards, and the home is then issued a license from Washington State. That also meant, if we did that, that the state would have to investigate any of our CPS issues. They would come on the reservation, and our homes, the reason that we only had 3 homes licensed on the reservation is that they didn't want an outsider coming in to do those investigations. And we were capable of doing our own investigations for all of our child welfare matters, but for some reason we were not, in their eyes, capable of handling these investigations if they were state licensed homes. So a big part of our process, too, is understanding how so many of the other programs overlap and enmesh with each other, especially when you're talking about child welfare with the realm of services that are involved. So we have a little bit about some of the other programs that we have within our department because they end up interfacing so much with each other. We started operating our own Child Support 4D program in April of 2002, and we were one of the original 9 tribes to operate the child support program under the interim regulations. We did not receive any of the startup money, and today we have approximately 450 cases. I think we're probably even higher than that now. We can establish paternity, child support. We enforce those orders. We also establish medical support, which you will, if you do not know already, will be most definitely doing if you're doing anything related to foster care. The child support program is based on achieving agreements between both parties. Our child support code is written as an agreement-based process, and the tribe does not go in and make recommendations on behalf of either parent. All TANF and foster care cases all are referred to the program to establish support and enforce them. And we have an agreement with the state that any cases involving tribal members and their children will be referred back to the program first for establishment and enforcement. About a decade ago, the tribe began discussions with the state to determine Medicaid and Medicaid eligibility for tribal members. It wasn't until 2007 that those discussions between the state and the tribe kind of started to become a little more of a reality. The state had to apply for a waiver to FNS to allow the tribe to determine food stamp eligibility, which I was trying to think of how food stamp eligibility came into it, but I actually think it was the state. The tribe was only requesting to do Medicaid eligibility, but we did have some encouragement from the state to also do food stamp eligibility if we were going to go that route. And so they applied for the waiver to FNS to allow the tribe to determine food stamp eligibility, and we were granted that. So an intergovernmental agreement was signed in 2009, which started a 5-year pilot project for us, and we have been determining in our office Medicaid and food stamp eligibility. So we can determine eligibility on the spot. We can issue their cards right in our office. I can't stress to you enough how much of a service that is for our tribal members. It's about a 70-mile round trip to our local CSO office, which is where they would normally have to go for those types of services. And transportation is a big issue for us. We did not receive any funds to do this. The tribe recognized the benefit and cost saving that would happen for us in the end. So we moved forward doing this program and budgeted for 2 full-time employees to run the program. We went through months of pretty intense training to learn how to use the state systems. But now tribal members can apply for and receive basic food benefits and medical coverage right on the reservation. We serve all Native Americans in the zip code. And we actually will serve anyone that comes in our office. Sometimes we have to transfer them to the local office, but we can at least get their application processed for them and get a card issued if it's an emergency. Low-income families access food stamps now, medical and tribal TANF all at the same time. We have more people coming into the office applying for benefits because they're more comfortable coming and applying for benefits to the tribal program. Families get medical coverage right away when they're coming to the tribal clinic, which lowers our costs because it goes back to the date of application. So with this, the tribe is eligible to receive match dollars. We get 50% match for Medicaid and 75% match for food stamps. We have an increased and faster access to Medicaid and food stamps for tribal members, and it helps our clinic get the encounter rate for Medicaid eligible visits that sometimes we were not able to do because people were still waiting or hadn't followed through with renewal certifications. So again, why is this part important to us? It's important because the more resources we have available to these people that are caring for our children, the more likely they are to be able to keep them for a longer period of time, right? So we have more people receiving food stamps. We have more people who are able to provide healthy food for the children. It provides that little extra benefit for them. And the biggest thing is that it gives us the opportunity to help tribal members get a medical child support order before the state issues one, because now we know the second someone's eligible for Medicaid or goes on to Medicaid. So our staff began drafting licensing standards. We used NICWA and Washington State as a model. And I meant to add this in here. We started our licensing process or drafting our standards through a SEDS grant through ANA. It was a 3-year project for us, and we would not have been able to do that without the additional grant funds. I wrote our licensing standards, and at the time was a child welfare caseworker with a more than full caseload trying to write the standards. And I assure you that those of us who have been working on this would have done whatever we had to do, put in as many hours as we had to do to make these things come to life, because it's something that was important to all of us to move forward with. So it would have happened, but it made it a whole lot easier for me to be able to stop, for us to basically fill my position as a caseworker and let me move over and just focus on the foster care program. We had a citizens committee made up of different tribal members within the community, lots of different ages, and made sure they were consistent with the S'Klallam Way. We spent a long time interviewing tribal members that had gone through the system, grandparents, aunties, kids that have aged out, talking to them about their experiences, trying to pull things from them that were important. We had our attorney review the 4E laws, ICWA, tribal code, to ensure that we complied with everything, and had our standards approved by tribal council. We actually skipped, so at this point, even though we have a good relationship with our state, they really weren't quite sure how to make all this happen. And so we had several meetings with them that we didn't have the right people at the table. And so we'd show up to a meeting and the decision makers that we needed were not present, and we couldn't move forward. So those meetings would stop, and we at some point decided we were just going to send our standards to Region 10, to ACF, and have them go through them for 4E compliance, which we did. And we then submitted them to Washington State and said, well, we've already had the feds review them, and they said they met the 4E compliance, so this is how we're going to do this. In a matter of less than 3 months, we had an agreement signed with the state of Washington to license our own foster homes. So we negotiated using a standard of foster home licensing equal to or exceeding the state. We haven't actually made any significant, I think we had one update to them with the Adam Walsh Act, but we haven't had to make any updates to those specifically since we wrote them. We use standards based on state and federal laws, not just state WACs. And in December of 2004, we signed our operational agreement with the state of Washington. In our state, we're able to determine our own licensing area. For us, just because we have a small area and not many resources available, we kept ours within our IHS service boundary, which is just within the county that we're in. We are looking to extend that a bit to some of the local tribes next to us that we'd like to partner with. So in 2003, we began discussions with Washington State to develop our 4E agreement. And in 2005, we signed our first tribal state 4E agreement and began claiming some of our children. Our staff worked with the DCFS state staff to correct existing data. We had a lot of errors in the state system. Some of our kids were not marked Port Gamble. Some of them had the wrong dates. There was lots of errors, and we weren't aware of them because we didn't have access to the state system at that point. So we literally sat with lists and went through each child one at a time and made sure their information was correct. We also were drafting our child welfare practice manual, which prior to this was all oral. It was a lot longer process than I think our attorneys had hoped for us to get an actual written manual, but it's something we're really proud of. It not only has the policy and practice that we want them to do, but it also has what we call a service tip in there. That is an actual direct quote from a tribal member as to why we do things that way. In 2008, we started drafting the 4E plan and really monitoring the legislation. In 2009, 3 years later, we had our council approve our practice manual for our child welfare program. And then we also unsuccessfully applied for the first round of the Title 4E planning grants. As I said, many of us on staff at that point really wanted to make this happen. We had been doing so much prep work for so many years that we were going to make this happen whether we had a planning grant or not. And I think for us it was a better route to go. We didn't have the pressure of the time constraints of the planning grant. It was difficult. I will say it's difficult. Andrea was trying to draft the plan as she's continuing to do the other work within the department. So it was extremely time consuming, but it was a priority for us and we made it work. And then in 2010, we submitted our first complete draft of the preprint and were told we would have to resubmit it in a new format. We submitted our original preprint before the tribal preprint came out. So it got sent back to us asking us for a new format and then took quite a while for us to negotiate. But it did bring a new beginning for us. In 2010, we resubmitted our preprint to Region 10, and we began meeting at least twice a month, usually more than that, to go over the plan. And initially, we were kind of jumping around throughout the plan as we were going through, trying to answer their questions, making sure things were in the right spot. And I know that the regional office would tell you that it's not something that you negotiate, but we will say that we negotiated our whole agreement, step by step, section by section. And there were a lot of barriers that we'll talk about at the end. And it was a very testing and trying process for us, but it is worth it. We were very careful not to create or modify our tribal code if something could be handled by policy. And for us, we made one very, very small code change, and that's it for our 4E plan. We gave a lesson to our federal partners on how the PGST government operation worked and what the approval process was for even a policy. We talked at length about language differences. Language differences were our biggest hang-up through the plan. Their idea of guardianship, our idea of guardianship are different things. We don't use the word permanency in our tribal code at all, and we were not willing to do that. So there were a lot of differences that we had to work out and things that we had to teach each other. And then we had to spend a lot of time explaining the current tribal state agreement because in our region, they didn't even understand how our tribal state agreement was working and how it was going to work because, again, I mentioned we have a good relationship with Washington State, and in essence, we kind of flip-flopped our agreement, so we're their middleman now instead of them being our middleman. So our state continues to pay our foster care maintenance payments for our children, and instead of them giving us a portion back, we give them a portion back for some of the claiming that they do for us. So some of the barriers, and Andrea will go into more about the preprint part of it and some of these barriers here, but the language differences, as I said, were the biggest one for us. A lack of understanding, complete lack of understanding of tribal government. For us, really not including the state in our earlier discussions was something that we really should have done, because the state could have really helped explain some of the, explain to the feds some of the things that they were struggling with, and could have probably sped up the process significantly. We had a lot of past due payments from our state for maintenance payments. Figuring that out afterwards was kind of a nightmare. I'm not sure that we still really figured out the total amount that we are due, but we wanted to make sure they paid up on all of that before we went into a new agreement. Lack of access to the state's data collection system. We do have access now. It's limited, and we're not sure how helpful it actually is for us. The lack of grant funds to support our costs. Our penetration rate actually went down, even though we had the same kids. We're still kind of puzzled by that one, trying to figure that out. I think the feds are a little bit puzzled by that too, but so we're working pretty closely with our region and the state right now to make sure things are being calculated and that they were being calculated the right way the whole time. And then for us, right now we're working on how we're going to be collecting and reporting our AFCAR data. So that's just a real quick overview of our PowerPoint. I'm sure everybody has lots of questions. We usually spend a pretty significant amount of time talking about the more technical details about 4E, but I will let Andrea talk a little bit about the process involved.
And I'll try and keep it short because it was a long process. It felt longer sometimes but you all know how that works already. In one of our initial meetings with Children's Bureau, I'm going to tell you this story just so you get a little bit of a snapshot. I always had to think of it that way when I was getting frustrated with our negotiations. So there were a group of us that went to one of the HHS tribal consultations. We do that all the time. You got to go to DC. And we had set up a meeting with Head Start, and we'd set up a meeting with Children's Bureau. Our first meeting was with Head Start, so if you've been to DC before, you go into that one building with the address, and then they walk you. You got to give them your driver's license, and you sign in, and they walk you through all of the machines, and then somebody escorts you up the stairs to wherever your building is, or wherever the meeting room is going to be. So I have my tribal chairman with me, I have a couple different directors, and I have another tribal council person, so there's quite a few of us. We go up to meet Head Start, we sit down in this one little waiting room, wait a little while, she takes us into this one waiting room, we have a really short 5-minute meeting, they ask us what we're doing afterwards, we say, yeah, we have another meeting, and they go, oh, okay, that's cool. We walk back down the stairs, we walk around the corner outside to the different address. We do the same process all over again, walk through all of the electronic equipment, sign in, get another name tag, and they walk us back up to the exact same waiting room so that we can meet with Children's Bureau in the conference room across the hall from where we just were. Welcome to negotiating your 4E agreement. So I always had to keep that in mind because honestly, they probably didn't talk to each other within those two services as well. For us, we have all of our services in one building. So Title IV of the Social Security Act, you have all of these social services. Title IV-A is TANF. Title IV-B is child welfare. I don't know what Title IV-C is. I think it's been repealed. I don't know what it was before. Title IV-D is child support, and Title IV-E is your foster care and adoption. When we were able to get Title IV-E directly. It was kind of a no-brainer for our tribe because we already did all the rest of it. So that was the last service that we really didn't have, at least out of Title IV. So as an issue and matter of exercising tribal sovereignty, there wasn't a question for us what we were going to do. And I did, and we all did, spend a lot of time arguing about what permanency really meant. I asked the question in that first meeting that I just told you about whether they had a problem with us following case management or practices that the federal law requires versus using the language that they use in those particular laws. And we were told, well, no, you can use your own language as long as the practice is fine. So that was the rest of it. That was the next 2.5 years. Oh yeah, but that's about practice, right? I don't need to use that word, right? The Regenton had to come back and think about that a lot, but they did. It was really good to work with them. Honestly, they were very helpful. They tried really hard to understand. 4E does really talk about how you can work with child support and how you can work with TANF and how you work with Medicaid. There's sections in that particular law that ties all of those services together. So it can seem a little overwhelming and it can seem a little bit of complicated, but at the end of the day, you are talking about your kids and somebody's life. So there's nothing more important than that. So if you have questions, let us know.
I just want to share that we've been able to claim anywhere from $60,000 to $90,000 each quarter through this process. And for us, that at least pays for our foster home licensor and a bit of one of our time as well. So it has been extremely helpful for us, and we quite frankly wouldn't be able to provide the services that we provide without it.